world for this really special event. This is an event put together by the One Campaign and by DevEx to bring you really the latest on what's happening on the COVID-19 response, what it might mean, especially for the lowest income countries in the world, for places where many of you work every day and are based. So thank you for joining us for this conversation. And I can't think of three people I'd rather be having it with. In fact, when I've mentioned this event is upcoming to many people in our community, they're all really excited to hear from each of you individually. It's great to have all three of you here. First of all, Gail Smith, who's the CEO of One. Thanks for taking time, to help put this event together, to give us your views. One is, of course, at the forefront of this and so many other global health and development issues. And you used to be the head of USAID. So we want to talk about your perspectives on that agency and on the US government response. We got Mark Dybul. Mark, who has worn many hats in the global health world over the years. You were really one of the leaders behind PEPFAR, the first US Global AIDS coordinator. You ran the Global Fund. You and I have spoken before on these issues. DevEx readers know you well. And so really appreciate you taking some time to be with us today. You're currently at Georgetown, where you co-direct the Center on Global Health. And Michael Gerson is also a name our audience and communities know so well, a columnist of the Washington Post, a former speechwriter and special assistant in the George W. Bush administration. You've been a leader on so many issues around the US government infrastructure and response and capability on global development and health and humanitarian issues. So really excellent to get your voice and perspectives here today. I thought maybe we could just start because people are really interested to know, the big story is what's going to happen in the poorest countries in the world. And yet that does not seem to be the story that's on the front pages of most newspapers or at the top of mind in many of the places where we're all sitting, especially here in the United States. So I'd love to get your takes on how you see the overall situation of COVID-19 and what's on your mind today when you think about it. Maybe we could just start with you, Gail, given your perch at One and your former leadership at USAID and in the Obama administration. Love to get your perspective.
Sure. I think what keeps me up at night, frankly, and there are a lot of things that could be keeping all of us up at night, is that we don't yet seem to have the recognition at the level of enough world leaders that this is in fact a global pandemic, and that given the nature of the virus, that it needs no passport or visa and moves freely. And we can see things like reimportation, that there's not yet enough focus on how we manage it globally. And while I understand that any country is going to be focused on its own emergency, I think we got to be able to walk and chew gum at the same time. And I think I've never seen a crisis of this proportion, but I've never seen a crisis where we haven't seen the kind of stepping up in leadership and knitting together, indeed a global response. It's a global pandemic and we don't yet have a global response.
And it's right in those two words, a global pandemic. I mean, it
Right.
suggests this is everywhere and we have to pay attention to it everywhere. And yet the way the world seems to be responding is very local. It's not even necessarily at the national level, it's very local, and understandably, but we've got to be able to look out a little bit broader, don't we? And the language really matters, especially someone like Michael knows so well. The way we think about this, the narrative frame really matters. You were quoted in DevEx yesterday, Gail, just talking about this lack of leadership, that there doesn't seem to be this leadership on the global stage. It's interesting to hear you focus on that in the beginning of your comments. How do you see the response going in the global South today?
Well, I think we've got a lot of leaders, both in government and outside of government, in the global South who are stepping up. And in these areas, there's actually been a lot of experience, whether with HIV and AIDS, which others can speak to, with the Ebola epidemic in West Africa. It also got, for example, to Africa later than it had moved through Europe and North America. So there was the sort of ability to watch and prepare a bit more. So I think we're seeing some positive things there. I think what's missing is the aggressive utilization of the United Nations, for example. One would have thought that the UN Security Council would have met by now. One would have thought that there would be emergency summits going on of world leaders. One would have thought that the robust response, both in response to the health crisis, but the attendant humanitarian and economic responses, would have been knitted together by now. And the tragic part about it, but the thing I think we have to build on, is one, we know a lot of what's needed. There are smart people, experienced people all over the world who know what some of the solutions are. So it's not like the problem is that we don't know what to do. I think collectively we do know what to do. And the second part is that we do have some leaders stepping up around the world. And I think Europe, I think New Zealand, I think there's been more attention, for example, to dealing with debt, for example, in the G20 as one means of injecting some liquidity into the market. But again, we don't have, and I guess that's not surprising. We're in a fragmented moment. We've gone through several years of international institutions being seen as more an obstacle than a tool. And I don't think we've been focused over the last several years on the fact that this was going to happen at one point. So let's all get ready. So I think the bottom line is it's up to a lot of people like us and the people who are watching and listening to this to figure out how we both persuade our leaders and use the institutions over which we have some influence to start to knit together that international response.
Gail, when you talked about who the leaders are in the world today, was noticeably absent the U.S. government in your list. And I wonder if we go to Michael, people who read your columns in the Post know well that you're not exactly a strong defender of the Trump administration. No. But you served in another administration that had originally people thought was, Republican conservative administration would be more skeptical about foreign assistance, but stood up some of the biggest institutions in our country's history when it comes to foreign assistance, like PEPFAR and the MCC and the President's Malaria Initiative. So I guess to Gail's point, I wonder what you would like to see the U.S. government doing today when it comes to this pandemic in the global South that we're not yet doing.
I think if you pull back just a little bit, I mean, we're in the worst public health crisis in a century. And the virus has been a step ahead in most of what's going on. We saw that in the delay of the Chinese response, the delay of the American response. And I think it's, created a real challenge. This is a circumstance where delay is the growth medium of this disease. And now we have a chance, I think, at least on the part of the developing world, to get some of it right. The risks, the dangers here are pretty clear. I mean, we have the danger of the growth of this disease in the global South, creating problems with mutation and rebound to the United States. It also could really undermine a lot of the hard-earned effort and work that we've done on other diseases like HIV/AIDS, like malaria. And so, I mean, the US has been the leader on these things. And if it's not a leader in this circumstance, it could undermine a lot of what it's done before. I'm afraid that this administration doesn't have the ideological tools to make an aggressive response in this case. I mean, their view of the world makes it difficult for them to play that kind of role. And that you're going to have leadership from the Congress. You're going to have leadership in the advocacy community. You're going to have leadership in other places in order to make this happen. Not so particularly in this fourth stage of the supplemental.
You would think that one of the ideological tools could just be self-defense, right? I mean, as you said, this is a pandemic that's going to go to other places and could come back. That you'd think even if you have a very narrow view of the world and you're highly skeptical of international organizations, that this administration could get together around, for pure self-interest, for kind of a security frame, let's do something here. Yeah, but we're not really hearing that yet. I mean, these daily presidential briefings, you just don't hear anything about the rest of the world.
Yeah, I mean, we've had a massive indication of the impossibility of isolation in our world. I mean, we have a single immune system when it comes to this kind of disease. We know that a disease in a distant village can become a global problem in 36 hours. And unless we're prepared, unless we take this seriously, I think it's falling down on a security need of the country. There's a lot of questions about whether we'll see a second wave of this disease. And a lot of that will be determined in the developing world. And so I think there is a way for this administration to say, just on narrow national interest, from that perspective, you can make a good case to be more active here. And that's what may need to happen.
I'd love to get your take, Mark, on that idea of a second wave. Tony Fauci, somebody you've worked closely with and are close to, has talked about it. Michael just raised it again. I know there's a lot of uncertainty, but what's your best judgment about what's likely to happen? Do you think there's likely to be a second wave back in the US?
Well, I actually wrote that was our biggest risk before anyone else was talking about it. So I have seen it as our biggest risk. And I just want to pick up on a theme, and a lot of this is in a white paper we put out from Georgetown called "A Global Pandemic Demands a Global Response." We can't get out of this on our own. What you're raising, I think, is the key issue, which is what is going to happen as the virus, best guess is, comes under some control over the next couple of months or so. Probably by the end of May, we'll see significant reduction in the number of new infections, but I'll come back to the risk of that not maintaining itself. But we know there's significant activity in the Southern Hemisphere. We don't know what it means yet. I mean, I am a little worried about people saying, oh, it's going to get out. We don't know yet what's going to happen in the Southern Hemisphere. It is not moving as quickly as we expected it could. And it's not just because of lack of tests. I mean, South Africa is doing better than just about anyone on the planet. They have a team of 28,000 people. They're doing 30,000 tests a day. And we're not seeing, even in places that don't have tests, we are not seeing a significant influx of people coming into the emergency room with problems breathing. So it does not look right now like there is significant spread. But, and I don't want to get into crazy land here about, the sun, temperature, humidity.
We like crazy land. Feel free.
Yeah. They are factors. And so there's no question that there are factors. The question is how big of a factor. And we know they can be overridden by population density, by inability to social distance, which is, if you're in Kibera or Kailicha, I mean, you cannot socially distance. Cultural norms don't allow for social distancing. And these countries, people forget, are heading into winter months, especially in the deep south. And South Africa actually has a pretty substantial flu epidemic every year. So the concern, and this would follow the 1918 flu pandemic, is that as we get more control in the Northern Hemisphere, the virus becomes more active and accelerates in the Southern Hemisphere with genetic mutation. I want to come back to that. And then a second wave would start in the fall. I do think it's important, the National Academy of Sciences pointed this out. In the last 250 years, there have been 10 flu pandemics. Every one of them, the second wave was 6 months after the first wave. Now, we don't know that this will follow the same pattern, but every one was 6 months after the first wave. So, and you do have this cyclical pattern in different parts of the world based on temperature, based on a whole bunch of other things. Africa is somewhat unique because it's young, right? So the median age in Africa is 19.7. The median age in Europe is 43.7. Huge difference. Young people, now there is also a lot of HIV, and everyone jumps to HIV, and that could be a big problem. Or a lot of people
suppresses your immune system.
Suppresses their immune system, malaria, malnutrition. I want to come back to malnutrition because we could see a real food disaster, food insecurity in sub-Saharan Africa. But young people on antiretrovirals, although young people are on antiretrovirals less, actually could be protected. We don't know that yet. We need to know that. These are important things we need to understand for ourselves. But then if you do have a lot of transmission that we can't see because we're not testing, in people whose immune responses are actually doing fairly well, like a large young population, that puts a lot of pressure on the virus to mutate. That's what causes mutation. We do have immunity to this virus. We know that because a lot cross-reactivity, because a lot of people are asymptomatic or mildly symptomatic. So some people are mounting immune responses. Young people are going to mount better immune responses. We know that than older people. So you could see a very silent, rapidly moving epidemic with rapidly moving mutations, which could make for a more virulent virus in the second wave that could be catastrophic. So we don't know any of that. To the point of what's in our self-interest, it's in our self-interest to understand that, to get down there now, have as many tests available, support the countries that can do mass testing because of the human resources they have, and the healthcare workers, as South Africa showed by fielding 28,000 community workers, has been shown in Ebola, has been shown in they're used to this. They have the resources, they can do it. Get out for the testing, identify the number that are available. You need the genetic test so you can see whether or not there's genetic drift, and support them to reduce the number of infections, because the less infection there is, the less the transmission is, the less the genetic drift is. It's also good for them because it's better for their countries. So we don't know if there's going to be a second wave, but I think we need to be very concerned about it, and we need to be prepared for it.
Right, and that's kind of the point of having a strong health system, right? Is that you don't know what's exactly going to hit the health system at any point. It could be a pandemic, it could be something else, but you need a system that's there. And a lot of what you just referred to is in that great white paper that Georgetown put out that you co-authored, and I recommend it to people. We can put it down in the links because it gets into some depth about this. And the point that you're making there is you could have reservoirs of this virus in parts of the world that then come back to us. And you could imagine a situation where our country has to go back to lockdowns, or we have to have border closures, or trade and travel get limited, migration gets limited, and that this thing extends for a really long period of time beyond the acute moment we're facing right now, because we don't have the systems in place. So I want to get Gail you back into the discussion, because a big part of your job when you ran USAID was to think about those systems globally and how the US government could support the buildup and strengthening of those kinds of systems. We've got you on mute. I mentioned that because you need to unmute yourself to talk. But USAID's just gone through a leadership change. Mark Green has stepped down.
Let me speak.
You can speak now. What do you want to see USAID doing now? What should USAID be doing to be putting in place exactly the kind of systems that Mark is pointing to in his comments?
Well, I'd say a couple things, Raj, and I think, look, you've got a group of people with you who've all been part of a really extraordinary US investment in global health. And I think that investment started to get to the point fairly quickly, and then layers have been built upon it, where in addition to addressing HIV and AIDS, TB, malaria, and Ebola epidemic, there was the gradual laying on of better systems and what we've called health system strengthening, which is something we all understand and as an advocacy message is deadly, but still it's very important. It's building that capacity. And one of the things we started in the Obama administration that still exists, although it's not had the kind of traction that I think we would have hoped, is something called the Global Health Security Agenda, which the premise of which was based on these joint expert evaluations to look at a very technical level at what countries need to be able to prevent, prepare, detect, and respond to these kinds of threats. How do we fill those gaps? And it's evident we've got gaps here in the United States. There are gaps everywhere.
But that points to the fact that that group was put together. We knew pandemics were a possibility. We knew that global health security was an issue.
This has been known for a long time. And the beauty of it, I've been muted again.
No, you're good. We hear you.
Muted. No, I'm unmuted. Sorry. I think the great advantage we have is something that Mark just referred to in his comments. And it's one of the reasons that I think global health is one of the issues that's gotten traction with the Congress, with funders, and with governments all over the world. It's a tangible, measurable thing. It's based on facts and science and evidence. And so that you can say, here's what we've done, here's what the outcomes are. You can measure capacity. You can measure transmissibility of a disease. You can do all sorts of things that, again, are fact and science-based. And I think that gives us a tremendous advantage going forward, because there's a wealth of knowledge. And as Mark points out, it's in our interest to know. And if you go back to Ebola, I mean, one of the things that struck me, and I am certainly not the epidemiologist in the room, but every day our scientists and medical professionals were able to tell us more than we knew the day before. And there is right now, similarly, a collaborative effort across the world of experts to take all of the data, all of the evidence we're getting all over the world, to start to answer some of the questions that Mark poses. So number one, I would like to see the United States have an interest, as Mark suggests, in finding the answers to those questions, because it's a matter of our national and our collective security and well-being. When it comes to USAID and the US response, but USAID, I think, is better at complex crisis response than any agency in the world. I mean, when I was administrator and when I was in the White House, there were more complex disasters going on at any one time over 8 years than at any time in history. Syria, South Sudan, Iraq, Haiti earthquake, Ebola, I mean, just on and on and on. And there's a great capacity there. What I've learned, and I think many of the people viewing and who are supporters of the One campaign, of DevEx, of all the work that Mark and Michael and others have done, was strengthening USAID and elevating USAID. And when I left government, USAID was on par with every other agency. It was, you know, we had done the 3Ds and all of that. And I think what we need to see now is if that agency still retains that status, it needs to be empowered and unleashed to go do what it can do very well. I'm not sure that that's happened because I think, again, if it were empowered to go forth and lead, I think we would see some more coordination among the donors. I think there's room for a lot of collaboration between USAID and CDC. They've worked together on HIV and AIDS. And as Mark and I both know, that's been mostly really, really good. There's obviously challenges when you bring two agencies together, but in Ebola, it worked very well. And when you combine those two things with the other agencies we've got in government and the extraordinary wealth of experience and expertise we have across 10 or 15 agencies, we could be out getting the answers to the questions that Mark points to. We could and should be out there getting ahead of what he rightly also refers to as a looming food security crisis, both at the community level, where we're already seeing huge strains on local well-being, food availability, and nutrition, but also in terms of global supply chains for food and some breakdowns, import bans being slapped into action. So I would like to see aid told to go forth, lead, take some risks, which is the other piece of this that's hard, but I think it's in our interest to take some of those. Ebola was a risky operation. Sending DART teams into places like Iraq, that's a risky operation. I think the agency knows how to manage the risks. But I think it's a question of seeing aid as a very powerful asset in government and relying on it to be one of the key players, not the only one, because to Mark's questions and comments, CDC obviously has to be a part of that. We've got a lot of other assets in government, but to be one of the tools that can enable us to respond, get the answers to questions, and to be part of the solution, because part of the solution here needs to be ending this crisis, but figuring out how the world's going to get its act together to be ready for the next one, whether that's a second wave in the short term or in the longer term. What we know will happen is another viral threat.
Can I just ask Michael and all of you, is any of this realistic? And maybe you can mute again, Gail, because I think you got a little echo. Yeah. Is any of this realistic in the Trump administration? I mean, you know, you talk about the ideological tools might be missing for them, Michael. I guess the question is, could we see, even in this administration, a big ramp up, a PEPFAR-like effort, you know, where there's new money put forward by Congress that's really significant, that the administration backs? There's a new effort led by a USAID to say, actually, the global nature of this does matter. The US does need to lead. Or is this just not really possible? Is it just, are we just going to watch, you know, kind of the US cede that leadership and other countries have to try to step up as they can? What's your take on it, Michael?
Well, you know, I have a tendency towards pessimism when it comes to analyzing the what the administration is up to. You know, the United States has lost leadership in a lot of different areas, and not just global health, but democracy and promotion of, you know, democratic ideals and human rights and a lot of other issues as well. So I think it's a real challenge. But, you know, what you need is high-level sponsorship within the administration, someone to carry this to the highest levels of the administration and say, we need to do this. It's good for our health diplomacy. It's good for our national interest. We need to put an emphasis here and tell the president that he can get credit for it. I think he wants to be seen as the person who responds, soon and well. You see that in his constant message in the press conferences. And so I think there's something to work with there, but it's going to take someone who carries this idea to the decision-making levels of the administration. I don't know who that is yet.
You would think having Debbie Birx in that role could be, key. You've got somebody there who was a U.S. Global AIDS coordinator, knows global health inside and out, and now clearly has the president's ear. You would think that her or others at the administration, that there would be some of that high-level sponsorship possible.
Yeah, but the problem is that I think that the leaders, we have an A team when it comes to global health. We've got really good people, but they are now very, very focused on the domestic effort, and it is consuming. I think we're not at the end of our crisis, and I think that it's difficult to turn to other issues in that circumstance.
Mark, you want to jump in?
Say something.
Well, our government is a complex government, and it is important to have presidential leadership, but you have Congress already putting $5 billion in for international, and I hope they'll put the additional $12 billion in that USGLC1 and other organizations are pushing Congress to put in for the next supplemental, which is going to be 1% of the 1.2 trillion. But if we don't act, and however we do it, whether it's Congress or the White House, we need to move now, because now is the pivotal moment. We're flying blind into our future. We have no idea what's going to happen with this epidemic, and we're flying blind, and that's not a good position to be in. As Gail said, the things that need to be done are not particularly complicated. This is very doable from multiple angles. The Africans are actually responding quite aggressively and quite well. The leaders are coming together, they're working together, they're looking at it as a continental issue, not just a country issue. And so I think what is possible might come out of Congress, but we need the rest of the world in this too. With the exception of President Macron and China, of course, getting into the game, I don't see anyone on the global stage jumping in. And that's a problem. So it's
that includes the UN, right? We had a question come in about the UN's program. It does feel like the UN's a little bit quiet on this. I don't know whether it's because they're just getting drowned out in the mix in an era of Trump and Boris Johnson and others, or what. But it doesn't feel like there is that other set of voices out there besides national leaders. I think Gail maybe wanted to say something about that. And you are muted again.
I'm the tech genius here in the room. But the United Nations is as good as its members. And the major powers in the United Nations right now, you've got the United States, China, and Russia, aren't exactly right now focused on how can we make multilateralism work. There's a lot of politics going on. So I think one thing is probably a reflection of the larger fragmentation that we've been seeing over the last few years. But I do want to point to, I think, a couple of opportunities that we've got on this going forward, because like Mark's notion of flying blind into our future is something we would all agree is exceedingly dangerous.
Best avoided.
And undesirable. Best avoided. It's always to have eyes open when you're facing forward. One is to go back to this point on the Congress. I think we all know that the fact that we've been able to do many of the things that have been done in the United States over the last many years has been the result of a bipartisan and in fact nonpartisan consensus on the importance of foreign aid well spent and invested in development and sustainable outcomes. And keeping that alive is really key, making sure that 12 billion is realized. It's not in the bag yet. I am encouraged by the fact that there are members in both houses, both parties, who understand, some of them because they've supported the long fight against HIV and AIDS, others because they see it through a national security lens or a values lens, that there is interest there. So I think we've got an opportunity to build on that. A second one is May and into early June is going to be a period where the issue of vaccines is on the table. Now, with vaccines, there should also be therapeutics as they become available. But starting the discussion about once those come online, we need to have a framework and a system to make sure that they are equally and equitably available. It's the right thing to do. It's also the smart thing to do. As we've all pointed out, none of us are safe until all of us are safe. That's something where Europe has taken the lead. The EU's been prominent in it. President Macron, who's been prominent in all of these issues, the Gates Foundation, Wellcome Trust, others, some of the big players on the philanthropic side. That's an opportunity for the US to get into a discussion that is absolutely critical for the most vulnerable in the world, but frankly, and again, also for us. What's the framework on vaccines and therapeutics going to be? They may not be developed in the United States. So you can take it down to quite a level of self-interest. So that's another, I think, moment in which we've got to make sure that we are all heard and we don't miss that opportunity. Because if we don't have a system for that, I don't know what the analogy is, we're flying blind into the future, into a future that's just going to be chaos and inefficiency. And as Michael pointed out, if we're not moving faster than the virus, it's winning.
Yeah.
So Raj,
Winning.
I mean, on the international front, Raj, I think part of the problem is we're still pitting sectors against each other. So it's either economic or health or food, not all of them together, not understanding that they all fit together. And fortunately, some macroeconomists and others are getting in to say, look, you can do whatever you want with restrictions. If people are afraid to go out into a restaurant, you can lift them all you want. If people don't feel comfortable, if don't feel like their health is protected, and polls are showing this, they're not going to go out no matter what you do with restrictions. So until we put the sectors together, and here I would point to Africans, the Africans initially made their task forces multi-sectoral, bringing in the economics folks, the food security folks, the security folks from the beginning. Governors are starting to do this. The United States should be able to do this. It's what we did with Ebola and other things. But as long as we're pitting these sectors against each other, it's very hard to have a global response. At the same time, if we would actually understand the links, how we respond for health now, testing, tracing, quarantine, the things we need to have in place here in Africa, everywhere in the world, we can actually manage a second wave if we put all that into place, and we can manage it if we're focused on the economic, what could happen economically at the same time, and what are the impacts of sanctions and our restrictions in different places like Africa and food security, for example. You can actually layer this stuff in a coherent way if you had a global task force, regional task force, national, subnational task force that bring these pieces together. It's very difficult for the international system to respond when we're still all in our corners, and we're in our corners because no one's leading. No one's saying this is a global pandemic that demands a global response that has to have all these sectors together. And if we can bring them together, we can I actually think no matter how bad a second wave is, we can manage it if we get our act together now and put the systems in place now in each country, but also around the world. I think we'll be fine. We will be stronger, more resilient, and able to cope with the future. But it's not happening. We're still in our rabbit holes, which is somewhat understandable. But to be honest, I'm getting to the point where it's not understandable.
Right. I mean, it's almost May, right? This is time by now.
And it's not like the US government only has 5 people. I mean, there are a lot of people in agencies that can be doing the work. This is even the global level. There are a lot of people around.
Right, well, it's unacceptable. And look, in managing an epidemic or a pandemic or any crisis, preparedness is one of the key elements, right? And I think there's this sense that, well, we kind of missed the preparedness phase, so we don't have to think about it again. This crisis unfolds in layers. And you've always got the opportunity and in fact the imperative to be prepared for the next chapter. So you don't drop the preparedness after the thing starts. And I think we don't have a common understanding. I mean, we got a piecemeal understanding, to Mark's part, in the United States or elsewhere, that this is happening in real time and that preparedness remains part of the response until we get to the end. And then quite frankly, it should be preparedness for the next one. So I think part of it, and you spoke to Michael on this, but I think it's absolutely key, and it's part of the frustration, I think, that we're seeing a bit more, but not as much coverage in the media on this. Our collective understanding of the pandemic is very one-dimensional. And it's not understood, I think, in the breadth, and I don't think it's that difficult to capture some of what I think we're all saying, that it's global, therefore borders matter only with respect to implementation. They don't really matter with respect to where this pandemic is going to go. That the challenge is to be prepared every day for what you're going to face tomorrow, 3 months, 6 months, 1 year out. And that again, as I think we've all said, we've got the tools, we've got the ingredients. The smart people are available to say, here's what we need to do. And I'm just struck, I don't know whether it's that the media is still and understandably so seized by the unbelievableness of it, or is focused on some of the more dramatic political dimensions of it. But I think part of what we need is a way for people to understand what this is. It's not complicated, but that captures the notion that it's in real time. We've got time to do these things now, but we've got to be every day preparing for what's going to come next. And that's not happening, I think, nationally or internationally.
I do think it's really important, at the point that Gail made, that we're working with willing partners that have been pretty effective. This is not a hopeless effort. This is a case where Ebola, the experience of Ebola, I think, has helped a lot of these systems deal with that, even weak health systems that have expertise on how to approach these things. And so I think we really do need to emphasize that point. I mean, Africa in many places knows how to use community health workers, for example, which are going to be important in this type of effort. And you're already seeing some of that. And so I think there are like strengths to work with here that, it is pretty amazing that I think the African CDC talked about, gathered a task force on February 3rd, which was quite early. And you had an entire continent approach this set of issues in weeks rather than months compared to what other parts of the world had been doing. And now, if they have the resources, I think there's a lot of expertise on the continent to try to do that. And that's going to require, rapid diagnostics and being able to know where the disease is and where to put resources. And they're going to have to think creatively about alternatives to lockdowns because they don't work in some places. They're going to have to look for other ways to restrict the disease. So, I mean, there are challenges here, including the food challenge, which I think is an extraordinary element of all this. That's happening at the same time. I mean, you do have a coronavirus crisis at the same time you have a locust plague in East Africa. And there are complicating factors here, but they do have a wealth of experience. And if you look even in the previous response, the countries that responded well, like South Korea and Hong Kong and Singapore, they're the ones who had experience with the SARS outbreak. They had the know-how and intention to do effective work. And I think the same is true in many African countries right now.
And a lot of that's because of the programs that all of you were involved in, like PEPFAR, right? Where the US has invested over many years in countries' ability to do testing and to do health education and outreach and to provide treatment. And there's a lot of uncertainty, which can make us feel a bit powerless. But I think, as Mark says, at the bottom, this is pretty basic. It's testing, tracing, quarantine, right? If you can get that in place, there might be a mutation. Things might shift, but you've got at least the infrastructure in place to do something. Go ahead. I think, Gail, you wanted to jump in.
Just pull the thread a little bit on something Mark said, which I think is also important here. There's the experience, there's been the layering on of systems. This has been part of an international dialogue between Africa and the rest of the world for a long time, but something's been happening on the continent over the last 5-8 years which is very significant here, which is the continent thinking, acting like a continent. And so the fact that the African Union has put this at the top of its agenda, has appointed envoys on it who are some of the most serious players with extraordinary experience on the continent, that they are debating and looking at and comparing notes on what the experience of lockdown or any other measure has been, that there's now an African CDC up and running. And I think there's actually a lesson for the rest of us on this, which is that when you pull together at that political level and organize beyond your own borders, I would wager, and we don't know what's going to happen, but I would certainly wager with some confidence that the net result of this in Africa, in all of its dimensions, health, economic, food, and otherwise, will be somewhat less and or better managed because there is that collective leadership and an investment of political capital in addition to financial capital and expertise. So, it's the one continent that had a common heads of state position on the SDGs. It's had a common position on peacekeeping and the UN debates, a common position on climate change. And I think that's going to matter quite a lot here because it's going to enable sharing information across borders and expertise and approaching this response with a kind of methodology and scientific awareness and engineering and logistics and all the things that are necessary to do it wisely and smartly. And I don't want to overstate it, but I think it's something very, very different, and it's not really well understood by those who see a train wreck coming with no hope at all. I think there's an important political.
I just wonder, taking that point, Gail, and taking Michael's point, we've got willing partners, we've got infrastructure in place, we've got countries that are better positioned than ever in many ways, but that lack the financial resources, right? And that might be at the tail end of, if this enters something like a global depression, which a lot of macroeconomists think could happen. You see the US dollar increase in value, you see commodity prices, many of these countries are major commodity exporters, drop. You see tourism, which is already basically at zero, stay at zero for a long time or stay very low. A lot of these countries get a lot of their foreign exchange from tourism. So, I guess what I want to know is how you all feel about the numbers of what we ought to be doing, the scale of what we do. Because, many of you were involved in things like PEPFAR. And when I think about $12 billion as part of the next, rescue plan from Congress, okay, that's great. That's something that's significant in normal times. But in a moment like this, shouldn't we be pushing for something much more significant, a moment of really significant scale? When our annual foreign assistance budget from the OECD countries is about $140 billion a year, shouldn't we be looking for something that sort of matches the ambition and scale of the federal stimulus programs we've seen here in the US, but for the world?
Yes. And, but there are different pieces of that, right? So there's the health piece. So what the 5 plus the 12, which would be 17 billion. Remember, PEPFAR's annual budget is 5 billion. So 17 billion as economic support for Africa from the United States alone on the health piece would be extraordinary, but we have to use it well and to support them. We can put all the money in we want, but if they don't have test kits, if they don't have the workforce, it doesn't matter. So the resources have to be matched to things that will fight the epidemic, which, as Gail pointed out, and they are doing rather well. Many countries are doing rather well. And as you pointed out, some of those systems were put in place for HIV, TB, and malaria. The machines that are necessary to look for the virus, they're using drug-resistant TB machines and HIV virus machines to do. And so the structures are there, the leadership is there, as Gail pointed out, on a continental way. So resources necessary, but so are things like test kits, PPE, and many other things. Because without them, you can have all those pieces and it doesn't matter. I don't think the US can be sending test kits. We need a lot more now, but others can. And they're also creating rapidly putting into place domestic production of these things. So we can support their domestic production of low-cost ventilators, of test kits, of other things. And the Africa CDC is out there. But this is my concern is that, and I think you raised this point, the health piece is one piece of it. Put those structures in place so that they actually can respond and that we are in a better position, wherever this epidemic goes, to understand where it's going, but also to have less replication happening, better health all over the world. But then what does an economic package look like for the continent as well, and the food relief programs. That's my concern. We're not putting these pieces together. So we've got the G20 with Gordon Brown pushing really hard, and the EU on an economic package. We've got money floating around for health with the World Food Programs. This has to come together in one coherent approach. And that's where a global pandemic demands a global response. You can't just look at Africa relief program for health and economics. We have to have a global approach. What does the global picture look like? What does the future look like? What are the scenarios? And the only way to do that, Bill Gates has called for it, we called for it a while ago, we need a global cross-sectoral task force that's then mirrored regionally, nationally, and subnationally to start putting these pieces together. This is not rocket science. This is not that complicated. If we do it well, we can come through this stronger, more resilient, with systems in place that can respond to other things. But we've got to be thinking globally, we've got to be thinking cross-sectorally, and we've got to be thinking that those global and cross-sectoral approaches are not to stand alone, to just parachute in, but to support similar institutions regionally, subnational, nationally, and subnationally. This is not that hard, but we're not thinking about it, we're not acting on it. So it's really just putting the pieces together, including the economic, the food security, and the health pieces, because right now it's just a scattered mess.
Yes, I think you're 1,000% right, Mark. And we're stovepiped, we're fragmented and stovepiped. And I think, look, on the one hand, I think we've all got to be fighting for the global leadership that can create the kind of task force that Mark describes that is needed, an integrated cross-sectoral team that's going to look at this, again, a global pandemic through a global lens. I also think we can't hold our breath and wait for that. So I think there's some other things that we can and should do. Those of us who are practitioners, advocates, out in the media, any of us, in terms of what we're trying to do. First is to weave these all together. And the fact is, if you look anywhere in the world, a response to this pandemic has multiple features. The pointy end of the spear is fighting the virus, right? And it's the things that we have discussed. Then you've got the impacts of that virus. And what are the impacts we're seeing consistently country to country? We're seeing a global economic crisis, and that economic crisis is reverberating in every country on the planet. We're seeing the exposure of extreme inequalities that many have been speaking about, but are laid bare completely, and that need to inform the rest of our response. We're seeing urgent emergency needs emerge on food. I mean, there are all these stories out in the United States. Oh my God, we're going to run out of meat. We all know that a crisis like this affects the most vulnerable the worst. So we have to start there. But you've got all of those. You've got the health dimension, you've got the economic dimension, and you've got the basic livelihoods and well-being dimensions that are sort of in the humanitarian category. I think we need to be pressing for all of these, but that it be part of a unified response, as Mark suggests. And I think when you ask, isn't there something really big we should be doing? I think a really big thing is talking about what a global response is in all of its dimensions. It's not just an emergency response over here, some more test kits over there, throw in 2 ventilators and a truck full of food. That's not what it is. It's integrated, it's coherent, and it's a systems-based approach. That's, as Mark says, it's not rocket science. It's like a good engineer and logistician can map this whole thing out. But I think the other big, bold things that have to be on the table. Look, if you look at the economic impact of this, we are looking at supplementals in this country. We're talking trillions every day as though it's nothing, right? This is happening all over the world. It is happening in low-income countries and the poorer parts of the world as well. There are ways to address that. There's systemic and structural ways to do that. We had a bit of progress on the debt measures that the G20 came up with. They're grossly insufficient. They're good. It's a great first step, don't get me wrong. But the same need to inject liquidity in the market here exists everywhere else. And
they can't do it everywhere else. They can't just print dollars like we can.
Exactly. So it's harder to do in low-income countries. So how do you deal with bilateral debt? We've got some progress there. Multilateral debt, we need more progress. And commercial debt. There are proposals forthcoming. This same kind of unified continental position in Africa is pushing on that. But part of what it requires in this notion of a global pandemic requires a global response is we got to figure out how to stop talking about that as though we've got the world and then we've got Africa and poor countries, right? The global economic crisis isn't just Europe, China, and the United States. It's also Africa. It is also Latin America. It is also Southeast Asia. How do we, as people who have voices in this, influence in this work that we're all doing in this, bring that into the mix? So when we say we need a global response to a global pandemic, what do we actually mean by global? It's not just rich and poor. We're part of the same planet. So I think there's openings, but there's work that we've all got to do on getting the narrative out there.
Yeah. Michael, I know you want to jump in and I want to get your take on another topic.
Yeah, I realistically, and I'm interested in the view of both Mark and Gail on this. I think Republicans in the Congress have been willing to support multilateral efforts. They're much more hesitant to support United Nations efforts. There's a difference there. And that is one of the problems when you lack executive leadership in the United States, because we often enter these coalitions, whether it's the Global Fund or others, and provide leadership for a global response in that context. I think the Congress can play an important role, but it's going to be very hard to have that global response. We're not just lacking mechanisms, we're lacking a focus of global leadership that will organize these efforts and put them into one thing. You know, it is difficult, particularly in the context of the food crisis. I mean, we're dealing with a circumstance in which 135 million people, according to the World Food Program, will soon be on the edge of starvation for a variety of reasons. And so, you know, that is going to require big thinking. But that requires leadership, and that's the problem with lacking executive leadership.
Can I just ask you on that point about multilateralism, the WHO, and what's been done there by the administration, the halting of funding? I mean, what's your read on where the WHO fits into all this, Michael?
Well, without being too cynical, I think that and maybe this is natural in politics, but when you have a disaster and to some extent a fiasco of the American response, then you assert for blame. You want to put the onus on other people. I don't think the administration is through with that as far as this, and WHO was a fairly easy target under that circumstances. And they made themselves a target to some extent. I mean, not that they were perfect in this response, but I don't think that the blame that's given them is proportionate to the problem. So, you know, and I would say, I won't kind of mention who might be next, but I think the administration may seek, rather than international cooperation, they may want to blame others, whether it's the Chinese or others in this system. You know, that's a real obstacle.
Yeah, it does seem to be the MO, right, going forward. And especially if this becomes a very long-term crisis where you have multiple layers, you know, where it starts with a health crisis, then you have a food crisis, and then a broader economic crisis, you're going to need a lot of scapegoats along that path if that's the approach that we're taking. Go ahead, Mark.
I do think Michael's point on leadership, executive leadership, is essential. I mean, nothing that was done in the Obama administration, nothing that was done in the Bush administration was possible without that executive leadership. I don't see it coming anytime soon. And so where else is there leadership? I'm hopeful that as some of the European countries start coming out of their own crises, we'll see more leadership on a global scale than we've done. But I'd come back to Africa, where the leadership is extremely strong. And if we can just get people to, whether it's the US Congress or the G20 or whomever, to support them, they're doing what needs to be done. Look at who they appointed as their envoys. Ngozi and Donald Kaberuka. These are finance people. Trevor from the Gates Foundation is the Help one, and of course Ngozi and Donald, the chair of the Global Fund, and Gavi respectively. But there is strong leadership there that if we can support, will make great strides. So let's look for leadership where it exists and support it. And there is executive leadership happening in a very substantial cross-country, cross-sectoral way, and we have a great example of it. Hopefully we'll start seeing more come out of other regions in a similar way, but right now we've got a really strong example, so let's put our support there to show what's possible, and maybe let's follow them. So global structures, again, should not be telling countries what to do. They should be responding to the needs of countries. The Africans are putting forward some very strong approaches and perspectives, are learning from each other. Maybe we can actually follow their leadership for a bit and support where they're going, so that that can then drive a much better global response as other people get their heads up.
Michael mentioned the Global Fund, which, go ahead.
Interesting focus of advocacy. I mean, we've seen in the past, let's pressure America to save the world, okay? And some of that has been useful in PEPFAR and other things. But I think we're now in a mode that Mark's talking about, where the focus of advocacy is going to say, strengthen people in Africa and other places in the developing world that are solving these problems themselves. I know that that's a type of advocacy one is very comfortable with, which is strengthening our partners, true partnership. Now, we had that in PEPFAR too, with country ownership of these plans and how all these came together. So I don't want to have a caricature of PEPFAR, but I do think that this is an opportunity to say, we're going to aid people who are confronting it themselves.
And it also has the benefit of being the right way to do development, right? I mean, it's the best practice is that everyone's development is local, it's owned locally, that they have the plan, they're invested in it, and you're supporting that. And you're right, that's not the way a lot of advocacy has been done. I mean, if certainly go back in the charity sector historically, where a lot of it's about look at the poor people and let's pity them and therefore support them. This is a different way of talking about the world's challenges and thinking more about empowerment than pity. I guess the question is it going to work? I mean, is it going to work with the administration? Is it going to work with Capitol Hill? Can we get this new kind of advocacy to actually yield the results we want it to?
I think we can, because that's the future. So we should be looking for where are the opportunities. And I hate to say that about a pandemic, but how do we come out of this stronger? How do we come out of this more resilient? How do we come out of this as the human family we were created to be? And we do that exactly what we've been talking about, by shifting our response, by shifting how we act. We will never react to a global pandemic if we expect a global institution or another country to solve it. Each country has to be prepared. Each country has to be connected to others. And so if we actually shift, which has been happening, and many of us have been navigating, shift from paternalism to partnership, actually service, not even partnership, but service to the countries that are there, respect and follow the leadership of the countries. And Gail can talk about Ebola. It was the presidents of those countries sitting down every day with their external partners to set the plan for that day. And so this is the shift that is necessary, whether it's climate change or food security or economic growth or how we deal with privacy. This is how we solve problems going forward. This is what development should be. And so we have an opportunity to actually do that.
It's hard to believe, but we've come to the end of this great discussion. I'd love you, Gail, to maybe kind of close us out with your thoughts, thinking about your perch at the One campaign. I mean, you do such a fantastic job at One, thinking about the inside and the outside game, right? How do you talk about these issues, these narratives that Michael and Mark just described to the public? But then also, how do you get in a room with a senator who might not share these same perspectives and somehow convince them? What do you think is the next step here for this community that's watching us right now, for people who care about global health and development? What should we be doing?
I think what we've just been talking about in this new kind of advocacy that is more rooted in equality than it is some uneven donor-recipient kind of relationship. As Mark says, it's the way things are going to happen anyway, and it's the way things should happen. And I think what we're finding is that when we go out to supporters and talk about the notion that vaccines should be made available to everyone on the planet, people are like, yes, like people are for that. People want to see, particularly at a moment where on the one hand, we're seeing global solidarity and a lot of solidarity between communities and within countries, but we're seeing our disparities unmasked in such a way that I think there's a real popular demand for the kind of equality and respect that says we should assume that leadership comes from leaders who lead like leaders and just follow the leadership. I think when you're doing the inside game, look, it's been my experience at one, and I think one is superb at this. But even when I was administrator, I had to make the case for a budget. Different people can have different points of entry. And for some people, their point of entry is that this is about values. This is about who America is in the world, what we stand for, what our leadership means. That's fine. For others, it's an economic issue. We need these countries, we need markets, we need to be able to export, so on and so forth. And for some, it's national security. It's in our national security interest to act. I think in this case, all three are at play. And all you got to do when you're talking to somebody once told me, talk to people where they are, not where you think they should be. And if you're coming from a values perspective and what is fundamentally right, which is sort of where I start, but somebody else is less focused on that and focused on the national security side, there's a good national security argument for us to get with the program pretty quickly here. So I think you got to talk to people where they are and not where they, but vest our hope in the fact that I think the majority of people around the world want to see the kind of collaboration, the kind of equality, and the kind of cooperation that we're all advocating and fighting for.
Well, I think everybody who's watching this, and really everybody in our community at DevX and yours at One, they're all just trying to figure this out, right? This is a very unusual moment. This is in some ways predicted. The experts knew pandemics could come, but we never lived through something like this before. And it really means a lot to get to hear from the three of you and to share your perspectives on it, and to kind of bring up a lot of the threads that we at DevX are covering. We'll continue to cover about what the multi-layered impact of this is going to be, what the response needs to look like, what governments and leaders at all levels need to do. So just a big thank you to all three of you for the work you're doing every day and for sharing your thoughts here. And we'll continue this conversation online in many different formats. But thank you and be well.
Thanks, Raj.
Thanks, Raj.
Take care, Mike. You're a new